Let me ask you something before we begin. How do you feel when you first wake up in the morning? Not after coffee, not after a shower. In that very first minute, when you open your eyes and take stock of how your body feels. Do you wake up feeling genuinely rested, light, clear, ready? Or do you wake up with that familiar heaviness, a bloated, pressured feeling in the abdomen, a burning sensation in the chest or throat, puffy eyes or swollen fingers, a sluggishness that takes the first hour of the day to shake off and sometimes never fully does? Most people who experience these things assume they are simply the price of getting older, the natural consequence of what they ate the night before, something to manage with antacids, or by avoiding certain foods, or by accepting that mornings are just uncomfortable. What almost nobody considers is the position they were lying in for the 6, 7, or 8 hours before they woke up. You spend approximately a third of your life in whatever sleep position you have defaulted to. And that position, the direction your body faces, how your organs are oriented relative to gravity, how pressure is distributed across your abdomen and chest for hours at a stretch, is not neutral. It is either working with your body's natural design or quietly working against it, every single night. Today I want to talk about one of the most overlooked and most immediately actionable changes available to anyone who wants to wake up feeling better, feeling lighter, less bloated, less reflux, more rested, more recovered. And the change I am describing costs nothing, requires no equipment, no prescription, and no special knowledge. It simply requires understanding why your sleeping position matters, and then doing something about it tonight. Let me start with the anatomy, because once you see the physical picture clearly, the rest of the conversation makes intuitive sense. Your stomach is not centered in your abdomen. It sits more toward the left side of your body. And it is not a simple pouch. It has a specific shape, something like a curved J, with an entry point at the top where the esophagus meets it, and an exit point at the bottom right where it empties into the small intestine. Make a loose C shape with your hand and look at it. That is a reasonable approximation of the stomach's orientation inside your abdomen. The open end of the C faces to the right. That is where the stomach exits toward the intestine. The curved body of the C sits more toward the left. That is where the bulk of the stomach's contents rest when you are upright. Now, imagine lying on your right side. The stomach tilts with you. The junction between the esophagus and the stomach, which has a muscular valve called the lower esophageal sphincter that is supposed to prevent stomach contents from traveling upward, shifts position. The stomach's contents, including its acid, are now sitting in a configuration where gravity is working against that valve rather than with it. The opening where acid can escape upward toward the esophagus is now at the same level or lower than where the acid sits. And the contents of the stomach are pooled against that junction rather than away from it. Now, imagine lying on your left side. The stomach's orientation shifts again. This time, the junction between the esophagus and the stomach sits higher than the bulk of the stomach's contents. Gravity now pulls the stomach's acid and food downward, away from the esophageal junction, and toward the stomach's exit point, leading into the intestine. The lower esophageal sphincter is working with gravity to keep acid where it belongs, rather than fighting against it. This is the anatomical reason why sleeping on the left side is consistently associated with fewer symptoms of acid reflux and gastroesophageal reflux disease, GORD, and why sleeping on the right side is associated with more. It is not subtle, and it is not theoretical. Multiple clinical studies have documented this difference in both healthy people and those with diagnosed reflux disease. A study published in the Journal of Clinical Gastroenterology directly compared esophageal acid exposure during sleep in different positions and found that right-side sleeping was associated with significantly prolonged acid clearance time, meaning acid that reached the esophagus stayed there longer when people were lying on the right. Left-side sleeping showed faster acid clearance and significantly less reflux. If you wake regularly with a burning sensation in your chest, a sour taste in your throat, or a feeling of pressure or rawness behind your sternum, and you are a right side or back sleeper, this is the mechanism behind what you are experiencing. And changing your position tonight is the most direct intervention available to you before anything else. But the reflux story, as significant as it is only one part of why sleep position matters. Let me take you through the others. Digestion does not stop when you sleep. The process of moving food through the digestive tract, peristalsis, the rhythmic muscular contractions that propel contents forward, continues overnight, albeit at a slower rate. And the direction that movement needs to happen is influenced by both the anatomy of the digestive system and by gravity. Your stomach empties into the small intestine, which then leads to the large intestine, or colon. The colon has a specific anatomical route through your abdomen. It rises up the right side of your abdomen as the ascending colon, crosses your abdomen horizontally as the transverse colon, and descends down the left side as the descending colon, before curving into the sigmoid colon and ultimately the rectum. When you lie on your left side, the descending colon, the final portion before waste reaches the rectum for elimination, is anatomically below the rest of the colon, oriented downward with the assistance of gravity. Waste is moving in the direction it is supposed to go, toward elimination, with gravity helping rather than opposing that movement. When you lie on your right side, the descending colon is oriented upward. The contents of the colon must now move against gravity to reach the next stage of elimination. The process is not impossible. Peristalsis is muscular and can work against gravity, but it requires more effort from the smooth muscle of the colon and may be less efficient, particularly in people whose colonic motility is already slower with age. This anatomical reality is why many people who switch to left-side sleeping report better regularity in the mornings, less of that backed-up, sluggish feeling that many adults over 60 experience regularly. It is not a coincidence. It is gravity working in alignment with the anatomy of the colon. Now let me talk about the lymphatic system, because this is one of the least discussed but most physiologically relevant reasons why sleep position matters for how you feel in the morning. Your lymphatic system is a parallel circulation system that runs throughout your body, collecting excess fluid, cellular waste, metabolic byproducts, proteins, and immune cells from your tissues, and returning them to the bloodstream for processing and elimination. Unlike the cardiovascular system, which has a pump, the heart, the lymphatic system does not have a dedicated pump. It relies on muscular movement, breathing, and body position to propel lymph fluid through its vessels. There is a critical anatomical feature of the lymphatic system that is relevant here. The thoracic duct, the largest lymphatic vessel in the body, drains the majority of the body's lymphatic fluid from the legs, abdomen, and left side of the chest, and empties it into the left subclavian vein near the left collarbone. This is the primary return point for lymphatic fluid from most of the body. When you lie on your left side, you are, anatomically, positioning the body in a way that supports the natural drainage direction of the thoracic duct. Gravity is assisting lymphatic fluid in moving toward its return point on the left side of the chest. The lymphatic drainage process, which is a central part of the body's overnight repair and waste clearance function, has a more favorable gravitational environment. When you lie on your right side, lymphatic drainage from the lower body and abdomen must travel against the dominant drainage direction to reach the thoracic duct's emptying point on the left. This does not prevent lymphatic drainage from occurring, but it may make it less efficient over the course of hours. The practical manifestation of this for many people is the difference between waking up with facial puffiness, swollen fingers, and a feeling of morning heaviness, signs that fluid has accumulated in the tissues overnight, versus waking up feeling lighter and less swollen. Many people who switch to left-side sleeping and pay attention to this specifically report a noticeable difference in facial puffiness and the general sense of fluid retention in the mornings within a few days. Now let me address the spleen and the immune dimension. Your spleen sits in the upper left abdomen, behind the stomach. It is a blood filtering organ. It removes old, damaged, and abnormal red blood cells from circulation, stores platelets and immune cells, and plays a role in the immune response to certain infections. The spleen is perfused by the splenic artery, which branches from the celiac trunk, and its drainage returns through the splenic vein. When you lie on your left side, the weight and pressure dynamics across your abdomen are oriented in a way that does not compress or place undue pressure on the spleen. Circulation to and from the spleen follows the normal anatomical route, without the positional distortion that right side lying can introduce for this organ sitting on the opposite side from where blood is pooling under gravity. This is a more subtle point than the reflux or lymphatic mechanisms. The research is less extensively developed here, but the anatomical principle is sound. Organs that are not being compressed or placed under abnormal gravitational pressure during their functional hours tend to function more efficiently. And the spleen's overnight work of filtering blood and supporting immune function is no exception. Let me now talk about circulation and cardiovascular considerations, because for older adults in particular, this dimension of sleep position is worth understanding. Your aorta, the largest artery in the body, carrying oxygenated blood from the heart, descends through the chest and abdomen slightly to the left of the spine. When you lie on your left side, the aorta's natural anatomical position is maintained without additional compression from body weight. Blood flows from the heart through the aorta and into the major arteries of the abdomen and legs, with the support of normal arterial geometry. There is also the matter of the inferior vena cava, the large vein that returns blood from the lower body to the right side of the heart. The inferior vena cava runs along the right side of the spine. When you lie on your right side for extended periods, body weight can place pressure on this vessel, potentially reducing venous return from the lower body to the heart. This is the primary reason that pregnant women are consistently advised to sleep on their left side. The growing uterus in late pregnancy places significant pressure on the inferior vena cava when lying on the right or back, reducing blood return to the heart and potentially affecting placental circulation. While the inferior vena cava compression is most significant during pregnancy, the same anatomical principle applies to all adults. Left side sleeping reduces the positional compression on this major venous return vessel. For people who experience swollen ankles or legs by the end of the day, common in older adults and those with mild venous insufficiency, anything that supports more efficient venous return during sleep is worth considering. Left side sleeping does not replace compression stockings or leg elevation for significant venous insufficiency, but it contributes to the same principle of facilitating rather than impeding venous return. Now, I want to address the nervous system dimension, because this is the piece that connects everything we have discussed to sleep quality itself. Your autonomic nervous system has two primary states: the sympathetic state, often called fight or flight, which activates when the body perceives stress or threat, raises heart rate, increases alertness, and diverts resources toward immediate response. And the parasympathetic state, often called rest and digest, which promotes recovery, digestion, heart rate reduction, and the deep repair processes that sleep depends on. The transition into deep, restorative sleep requires the nervous system to shift decisively into the parasympathetic state. And that transition is influenced by what is happening in the body as you lie down. When digestion is proceeding efficiently, when stomach contents are not backing up toward the esophagus, when the colon is moving waste in the right direction, when lymphatic drainage is supported, the body sends fewer distress signals through the vagus nerve, the primary nerve of the parasympathetic system, which runs from the brainstem through the chest and abdomen, connecting to nearly every major organ. When the vagus nerve is receiving signals from a digestive system that is functioning smoothly, no acid reflux irritating the lower esophagus, no excessive abdominal pressure, no distension from backed up digestive contents, it sends calmer signals to the brain. The nervous system interprets this as a safe, stable internal environment. The parasympathetic state deepens. The body moves into the more restorative sleep stages more readily and stays there more consistently through the night. When the vagus nerve is receiving signals from digestive discomfort, acid in the esophagus, bloating, abdominal pressure, constipation, the nervous system is receiving mild but persistent stress signals even during sleep. The parasympathetic state is partially maintained. You are still sleeping, but the quality of that sleep is compromised. You move through lighter sleep stages more frequently. You may not reach the deep, slow-wave sleep stages where the most significant tissue repair, hormonal regulation, and immune function occurs. And you wake up feeling less restored than the hours of sleep would suggest you should. Left side sleeping, by supporting the digestive and drainage processes I have described, creates a quieter internal environment for the vagus nerve, and therefore a more favorable neurological condition for deep sleep. This is why many people who switch to left side sleeping report not just feeling better in the mornings from a digestive standpoint, but also noticing that they feel more rested, as if the same number of hours of sleep is producing more recovery. Let me also address back sleeping and stomach sleeping briefly, because it is worth being clear about these positions. Back sleeping is often presented as the ideal neutral position, and for spinal alignment, it does offer certain advantages. However, back sleeping has two significant disadvantages for older adults particularly. First, it places the stomach in a position where the lower esophageal sphincter must resist gravity alone. There is no positional advantage keeping acid in the stomach, and for anyone with any tendency toward reflux, back sleeping can be as bad as right side sleeping in terms of acid exposure. Second, back sleeping is associated with significantly higher rates of sleep-disordered breathing, snoring, and obstructive sleep apnea, because the tongue and soft palate tend to fall backward into the airway when the jaw relaxes in the supine position. For anyone with diagnosed sleep apnea, back sleeping is particularly problematic and should be actively avoided. Stomach sleeping, lying face down, places the spine in an extended position for hours, which is one of the least favorable positions for the cervical and lumbar spine. It also requires the head to be rotated to one side for the entire night, placing asymmetric stress on the neck muscles and cervical joints. Stomach sleeping is associated with increased morning neck and back pain, and it offers none of the digestive or cardiovascular advantages of left-side sleeping. If you are a stomach sleeper and experiencing morning neck stiffness or back pain, the position is very likely a contributing factor. Now, the practical question: how do you actually make the transition to left-side sleeping if you are a habitual right-side or back sleeper? Body position during sleep is partly habitual and partly structural. If you are not comfortable in a position, you will naturally roll away from it during the night, even if you start in it intentionally. The key is making the left side position genuinely comfortable from the beginning, so your body has no reason to move away from it. The most effective structural support is a pillow between your knees. When you lie on your side without knee support, the upper leg tends to fall forward across the lower leg, creating a rotation in the pelvis and lower back that becomes uncomfortable within the hour. A pillow, or a purpose-made body pillow, placed between the knees keeps the pelvis level, reduces lumbar rotation, and makes the side-lying position sustainable for the whole night. Many people who have tried side sleeping and found it uncomfortable report that knee support entirely resolves the issue. Neck support is equally important. Your pillow height should be sufficient to keep your head and neck level with your spine, not angled upward or downward. A pillow that is too flat when you are on your side will let your head drop toward the mattress, straining the cervical spine and upper trapezius muscles. A pillow that is too thick will tilt your head away from the pillow toward the ceiling. The right height is one where your ears, shoulders, and hips are in a straight horizontal line when viewed from the front. Some people find it helpful to place a small pillow or rolled towel against their back, not to lie on, but as a physical stop that prevents unconscious rolling onto the back during the night. This is a low-tech but effective way to train the body to stay in the left lateral position. If you wake in the night and find yourself on your right side or back, simply move back to the left. Do not force it. Simply make it the direction you return to. Over a couple of weeks, the habit consolidates, and you will naturally stay in the position for longer stretches without conscious effort. One nuance worth mentioning. Left side sleeping does put the heart slightly lower in the chest than right side sleeping, and some people, particularly those with certain pre-existing heart conditions, occasionally report a heightened awareness of their heartbeat in the left lateral position. For most people, this is simply normal anatomical awareness and not a concern. However, if you have diagnosed heart disease, arrhythmia, or pericardial conditions, or if you experience any unusual cardiac symptoms when trying a new sleep position, please mention this to your cardiologist before making a sustained change to your sleep position. For the vast majority of adults without significant cardiac pathology, left side sleeping is entirely appropriate and poses no risk. Let me give you a clear, practical plan for the next 7 nights. Tonight, begin on your left side, pillow between your knees. Pillow height adjusted so your neck is level. A rolled towel or small pillow behind your back if you want a physical reminder to stay in position. Over the next 7 mornings, pay attention to 5 specific things when you wake up. The first is abdominal pressure and bloating. Is the heaviness or pressure in your upper abdomen reduced? The second is reflux symptoms. Is there less burning in the chest or throat, less sour taste, less rawness? The third is bowel function. Do you move your bowels more easily in the morning? Do you feel less backed up? The fourth is facial and hand swelling. Do your eyes feel less puffy? Your fingers less swollen? The fifth is overall sleep quality. Do you feel more rested from the same number of hours? Most people notice at least 1 or 2 of these dimensions improving within the first 3 to 4 nights. Some notice changes by the second morning. The improvements are often subtle at first and become more consistent as the habit establishes itself. I want to close with something I think is important to say directly. We spend enormous amounts of time, money, and attention on supplements, on dietary protocols, on exercise regimens, on tracking devices that monitor sleep quality from the outside. And all of those things have their place. But one of the most powerful and most neglected opportunities in the entire health landscape is what happens during the third of our lives we spend asleep. And specifically, whether the position we are in during those hours is supporting the body's natural processes or quietly working against them. Your digestive system has a preferred orientation. Your lymphatic system has a preferred drainage direction. Your colon has an anatomical path that gravity can either assist or oppose. Your esophageal sphincter is either working with gravity or against it. Your venous return from the lower body is either facilitated or impeded. None of these things are dramatic on any given night, but compounded over months and years, over thousands of nights spent in the same position, the cumulative effect on how you feel, how you digest, how you sleep, and how your body recovers is genuinely significant. The change I am describing tonight requires no money, no equipment beyond a pillow between your knees, no dietary restriction, no morning routine, just a conscious decision about which way to face when you lie down. Try it for 7 nights. Pay attention to what you notice. Let your own body's response be the evidence. If this was useful to you, please subscribe to the channel and share this with someone in your life who wakes up bloated or with reflux or more tired than the hours of sleep should explain. This might be exactly the simple shift they needed. Leave a comment below and tell me, which side have you been sleeping on? And if you try the switch, come back and tell me what you noticed. I read every comment, and your responses help me understand what this community needs most. I am Dr. Julian Cross. Take care of yourselves tonight, turn to your left, and I will see you in the next one.